Good day, everyone. I am Angela Dominic Policarpio from Section 11E, and today we're going to perform the return demonstration for assessing the abdomen. Assessing the abdomen is part of comprehensive health examination, and then it also helps us to explore the GI or gastrointestinal complaints, and then to assess the abdominal pain, tenderness, and masses, and then lastly is to help monitor the client post-operatively. So let's proceed for the preparation for the assessment of the abdomen. So first is, prior to performing the procedure, check the doctor's order for the need to perform the assessment to verify the order. Unfortunately, we don't have the doctor's order here, but I am obliged to continue the assessment with or without the order of the doctor. So next is perform hand hygiene, apply gloves, and observe other appropriate infection prevention procedure. And also prepares equipment needed for the assessment. So by performing hand hygiene, this is to deter the spread of microorganisms. And then by preparing the equipments, because organization enhances the nurse efficiency in performing the procedure. First, I'm going to remove my wristwatch. And then apply the 70% alcohol solution to deter the spread of microorganisms. And then apply or wear the gloves. So the materials that are needed for this assessment, namely, are stethoscope, working gloves, then the ruler, the tape measure, and lastly the marking pen. So next we're going to do is to introduce self and verify the client's identity using the agency protocol. Explain the procedure to the client, especially for about the need to assume several positions for this assessment. By introducing self, this is to enhance the rapport with the client, and then verify the client's identity to ensure that care is being rendered to the correct patient. And then by explaining the procedure to the client, this is to reduce the anxiety of the client and also promotes cooperation with the client. Good day, ma'am. How are you? My name is Angela Dominic Policarpio, your student nurse for today. What is your name, ma'am?
Raisa C. Pulcarpio.
Your birth date, ma'am?
January 2010.
Can I see your wristband, ma'am? For now, I am going to conduct an assessment of your abdomen, which means I'll check your tummy for any abnormalities or any possible problems. This will just last for 15 to 20 minutes, and all you have to do is relax, and then I'm going to require your attention and cooperation throughout the procedure. Especially, there are positions that are to be assumed later. So next is we're going to provide client's privacy. This is to protect the client's integrity and also enhances comfort. So now I'm going to close the door, close the windows, and draw the curtains to provide client's privacy. Next is ask the client to empty the bladder before beginning the assessment. Ensure that the room is warm, and then instruct the client to remove the clothes and put on the gown. To eliminate bladder distension and interference with an accurate examination. Mom, have you peed?
Yes.
Mom, in our assessment, it is required to empty your bladder before beginning the assessment. So, Mom, can you proceed to that area to urinate?
Yes.
Is the temperature of the room warm enough for you, ma'am?
Yes.
Since it is, You may now remove your clothes and then wear this examination gown. Next is help the client into supine position with the arms folded across the chest or at the sides. And then places a flat pillow under the client's head for comfort. And then lightly flexes the client's legs by putting or placing a pillow or rolled blanket under the client's legs and knees. This position promotes relaxation of the abdominal muscle. Next is drapes the client with sheet so that the abdomen is visible from lower rib cage to the pubic area. Next is instruct the client to breathe through the mouth and to take slow and deep breath. This is to promote relaxation. Now, I want you to take slow, deep breaths through your mouth to relax your body. So, let's proceed to assessing the abdomen. But first, let us inquire if the client has any history of the following. We have here the incidence of abdominal pain, tender areas, location, onset, sequence, chronology, frequency, quality, and also associated symptoms, the constipation or diarrhea, and then change in appetite, and also food intolerances, and then lastly is the food ingested for past 24 hours. Because proper history taking creates a good direction all throughout the assessment. Now, I am going to ask you some questions and I want you to answer it honestly, okay? Was there any incidents that you've experienced pain in your abdomen?
No.
Do you notice changes in terms of your appetite and weight recently?
No.
Are there times when you experience difficulty in swallowing? Have you felt nauseated recently or have you vomited? Have you experienced any indigestions, diarrhea, heartburn, or belching? Does your abdomen feel bloated? Do you have pain associated with eating?
No.
Do you have history of stomach ulcers, gallbladder surgery, or having yellowish skin?
No.
Alcohol use, medications, food ingested in past 24 hours.
Wala lang og alcohol pero may tao for example.
So let's move on to inspection for the abdomen. So first is inspect the abdomen for the skin integrity, the coloration of the skin, the vascularity of abdominal skin, and then also note for any striae, scars, lesions, and rashes. So now I'm going to inspect your abdomen. Ma'am, is it okay?
Yes.
Abdominal skin may be paler than the general skin because of seldom of exposure. Unblemished, intact, no rashes, no lesions may have molds. Scattered fine veins are visible. Uneven or white striae from weight gain. Pale, smooth, minimally raised old scars. So, next is inspect the abdomen for contour and symmetry. Next is observe the abdominal contour profile line from the rib margin to the pubic bone while standing at the client's foot. Then, ask the client to take a deep breath and to hold it. This makes an enlargement of the liver and spleen more obvious. No evidence of enlargement of spleen and liver. Next is assesses the symmetry of contour while standing at the foot of the bed. I will now move and stand at the foot of the client and then check the symmetry of the contour. Symmetric contour. Next is, if distension is present, measure the girth by placing the tape measure around the abdomen at the level of the umbilicus. Since there is a distension, I will now going to measure the girth using this tape measure by placing the tape measure around the abdomen at the level of the umbilicus. Symmetric contour. Next is inspect the abdominal movement when the client breathes in, the respiratory movement, and also observe for aortic pulsation. And lastly, observe for peristaltic waves. So right now, I am going to inspect for the abdominal movement, the aortic pulsation, and also peristaltic waves. Abdominal respiratory movement may be seen especially in males. No vigorous, wide, exaggerated pulsation or abdominal aortic aneurysm. No evidence of peristaltic waves increase. Then, inspect for the abdominal movement associated with respiration, peristalsis, and aortic pulsation. Lastly, for the inspection, observe for the vascular patterns. So, no vascular patterns being noticed. So, let's proceed to auscultation for the abdomen. So, first is auscultate the abdomen for bowel sound, vascular sounds, and peritoneal friction rub. Warm the hands and the stethoscope diaphragm. In this assessment, I will now going to use a stethoscope, but specifically, I will be going to use the diaphragm of the stethoscope. Because intestinal sounds are relatively high pitch and best accentuated by the diaphragm. But first, I will now going to warm my hands and then the diaphragm. Cold hands and a cold stethoscope may cause the client to contract the abdominal muscle and their contraction may be heard during auscultation. So I will now going to put the stethoscope on the RLQ and then move the stethoscope clockwise after 1 minute every quadrant. Next is use the flat disc diaphragm and ask the client when he or she last eat. Ma'am, when did you last eat?
1 hour ago.
Then places the diaphragm of the stethoscope on each of the four quadrants of the abdomen. Listen for active vowel sounds like irregular gurgling noises and then for 5 to 20 seconds. Audible vowel sounds. So for the vascular sound, use the bell of the stethoscope over the four quadrants. Listen for Browy and peritoneal friction rubs. So before I will be going to use the bell of the stethoscope because Browy are low pitch or murmur like sound. I will first going to warm the hands and also this bell of the stethoscope. Absence of arterial Browy. So for assessing the peritoneal friction rub, I have to use the diaphragm of the stethoscope. Listen for the venous hum in the epigastric and umbilical area. Absence of friction rub. So let's proceed to percussion of the abdomen. So first is percuss several areas in each of the four quadrants to determine the presence of tympani and dullness. Use a systematic patterns. Tympani over stomach or gas field, and then the dullness over the liver and spleen or full bladder. Next is percuss the liver. Begins with the right lower quadrant at the mid-clavicular line and percuss upward. Note the change from tympani to dullness. Mama will going to put your or place your hand near your head, ha. The lower border of liver dullness is located at the costal margin 1 to 2 cm below. There is no evidence of splenomegaly. Ma'am, now I will be going to perform a blunt percussion. Tell me if you feel any pain, ha?
Yes.
Feel any pain?
Yeah.
No tenderness elicited. Dull thud is sensed. So next is instruct the client to sit with his or her back to you and then performs blunt percussion on the liver by placing your left hand at the costovertebral left hand flat at the costovertebral angle over the 12 rib by using your ulnar side of your right fist to strike the left hand. So, ma'am, please adjust to a sitting position with your back facing me. So, ma'am, tell me anything if you feel any pain, ha? So, places the patient into a supine position with the pillow under the knee. Balik ta, ma'am, ha? Ay, let's lay it yan, ma'am, ha? Ask the client to take slow, deep breaths through the mouth. So, ma'am, can you take a slow, deep breath, ma'am? So, ma'am, do you have any pain in your stomach, ma'am, in your tummy? So, the patient reportedly said that there is no pain on her stomach. So, let's proceed to the palpation of the stomach. No pain? Yes. Pain? Are you feeling pain? 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 Any presence of pain? So, for the palpation of the spleen, we have to stand at the right side of the client. And then, we're going to reach the abdomen and support the tummy with the left hand at the posterior rib cage. And then, we're going to locate for the left costal margin. So, here it is. And then, we're going to use this right hand and place it on the spleen area or location, and then it must be on at the direction of for the client's head. So, ma'am, can you inhale deeply and then release? Usually, it is not palpable. So, for the assessment for the kidney, let's assess first for the right kidney. So, we'll stand at the right side of the client, and then with the help of our left hand, support the right posterior flank, and then place your right hand on the mid-clavicular area at the costal margin. And then, ma'am, can you inhale please deeply? And for the left kidney, we'll have to support the left posterior flank. And then, place the right hand on the costal margin at the mid-clavicular line of the left. And then, ma'am, can you please inhale? An empty bladder is neither palpable nor tender. So, for the symphysis pubis, we'll just locate for the symphysis pubis and then palpate upward and then slightly upward. So let's now proceed to test of ascites. This is for shifting of dullness. So for the test for ascites, so ask the client first to raise her both hands. So ma'am, can you raise your both arms, and then make sure that the client is in supine, and then percuss the from the navel to outward. So note for the changes for tympani to dullness. And then help the client to turn to the one side. And then from bed to the upper note again for the tympani and dullness. The borders between the tympani and dullness remains constant throughout position changes. So let's now proceed to the rebound tenderness. So for the rebound tenderness, position your hand at the mid-clavicular line at the between the navel and then the right anterior iliac region. So here, and then deeply palpate at 90 degrees angle. So then ask the client where it hurts more, at the pressing or the releasing. So ma'am, mag-ingon ka kung kung asay masakit katong pagtusok or katong pagtanggal. So itusok na nako ma'am.
Percussion.
So the client reported that it hurts more at the pressing. And then, ma'am, can I ask you where is the location, the specific location of pain? So, ma'am, asa tong kuan sakit na part. So the client reported or illustrated that it hurts more at the where I did the palpation. So there is no rebound tenderness is present. So let's now proceed to the referred rebound tenderness. So for the referred rebound tenderness, so I'm going to position my hands at the left lower quadrant. So here, and then palpate deeply and quickly release. Then ask the client if the right tummy or side of her tummy hurts. So ma'am, kung itusok na rin ako, ma'am, hain ko nimo na kung sakit ba, galing diri na side, bisan diri ko magtusok, diri aging sakit, ha? So, magtusok na ko, ma'am. There is no referred, so the client reported that there is no referred rebound tenderness. No rebound pain elicited. So let's now proceed to the assessment of SOA sign. So for the assessment for the SOA sign, so I'm going to instruct the client to lie on her left side. So ma'am, lie on your left side, ma'am. Then I will going to extend the client's leg and then instruct the client to tell me whether there is presence of pain at her tummy. So while I'm doing it, so ma'am, ignon ko nimo kung sakit mo yan, ha, kung ako i-extend din yung mga legs. Then I will going to hyperextend. So ma'am, is there any presence of pain at your tummy? So the client reported that there is no presence of pain at her tummy while I'm doing the extension. extension of her leg. No abdominal pain present. So let's now proceed for the assessment for obturator sign. So for the assessment for the obturator sign, so I'm going to ensure that the client is in a supine position. And then I'm going to support the client's knee and ankle. And then I will going to instruct the client to inform me whenever he felt any pain at her abdomen while I'm doing the rotation for her legs. And then ay ma'am, iingon ko nimo ma'am ha kung magsakit ba imong kami kung ako ning ikuan ako ning i-rotate. So now I'm going to flex the knees and the ankle of the client. And then I will going to rotate this internally and externally. So ma'am, is there any presence of pain? So the client reported that there is no pain at her abdomen while I'm doing the rotation for the client's legs. No abdominal pain present. So we are now in performing hypersensitivity test. So now, let us perform the hypersensitivity test. So first is ensure that the client is in a supine position or neutral position. And then, ma'am, I'm going to pinch your abdomen, ma'am. So please inform me whether you feel any pain or exaggerated sensation while I'm doing this. So, ma'am, ingnon ko nimo ma'am ha kung naabay kinasakit-sakitan kung ako ba kaning kiniton ha. So, I will going to pinch the abdomen using my thumb and then the index finger. So then pinch several times along the abdominal wall. So, ma'am, do you feel any pain or exaggerated tenderness while eye sensation while I'm doing the pinching of your stomach? So, the client reported that there is no exaggerated sensation or pain present while I'm doing the pinching of her abdomen. No pain and no exaggerated sensation. So, let's now deal for the test for cholecystitis. So, let us now proceed for the test for cholecystitis. So, this is to assess the right upper quadrant pain or tenderness. So, ma'am, mag-pinch ko ay mag-push or press ko sa imong diris area, ma'am. So, ma'am, can you tell me na if ever na sakit ang imong diri while sakit kaayo, ma'am, while ako ni ma'am, i-press, ma'am, ha? Tingnan ko rin mo. Ma'am, can you inhale deeply, ma'am? Okay, exhale. So, is there any pain, ma'am? So, the client reported that there is no pain while I'm doing the pressing of the liver border. No increase in pain is present.